Thank you very much for still staying with us right here on Plus TV Africa. It's still the Inauguration Day special. Now we'll be looking at the health sector from the deplorable state of hospitals to HMOs. I'm being joined now by Dr. Ladele, a medical practitioner, as well as Arinye Dokiari, a medical doctor. Thank you very much, lady, gentlemen. I hope I pronounced your name. Elite, I tried my best to. Now we are talking about the health sector now. Some would say health is wealth, and it's time to do a check of how wealthy we are as a country from 1999 till 2015, and now the president is also taking office again for a second term. You remember the days of primary health care within the likes of Olufemi Ransom Kuti. We can't compare those days and now,
no,
and not at all. So what was the model that was put in place then, and why can't we replicate that, or why isn't our health sector working today?
Well, you are trying to put words into my mouth, isn't it? Individuals differ in the way they approach things. Professor Olukoyera Kuti's area is purely primary healthcare, especially kids, pediatrics. So he was concerned about pediatrics. And at that time, he was having a direct access to the president. That was the military president, who had a lot of respect for him. And then you remember some of the stories of money being put in his account. He would say, what for? And all that. I'm not saying those who are there now are amassing wealth. But what is happening in this country is that we have really not chosen health as an issue that should be looked at.
Okay, Dr. Tunde, you just said something that's very critical as we're starting off with a new clean slate, that we've not really placed a priority or premium on health.
Yes.
We'll take a quick break now, and when we come back, the conversation continues in just a moment. Glad to have you back, and you're still watching the Inauguration Day special right here on Plus TV Africa. And still in our Lagos studio, we have Dr. Tunde Ladele. Thank you very much for staying behind. And we also have Arinye Dokiari, a medical doctor as well. Thank you very much, ladies and gentlemen. Now, before we took that short break, Dr. Tunde, you were talking about doing a comparison between the days of Olufemi Ransom Kuti in terms of primary health care and now is a no-no. Please expatiate.
Yes, what I said, and I'll repeat, is that priorities differ. Depends on who is on the seat. In the days of late Professor Olukoyera Kuti, he could be described as a super minister who has direct access to the president and gets things done the way he wants it. I wouldn't say the same. And then again, this general idea of taking health as being a matter of political necessity is not there, but was there then.
Dr. Obele, now, do you think we have, Dr. Tunde just said that we haven't placed a premium on health care. Now, does that explain why we have the deplorable state of our hospitals today? Out-of-pocket expenditure so high, and the NHIS, we can't even seem to say has any coverage at all. Do you think these are the reasons why we are having this current realities?
Definitely, of course, I believe so, because I was not there in the days of when he talked about, but when I was a child, I think the healthcare system was a lot better than it is right now. I think it was a lot better because a couple of times I went to the hospital, private hospital, government hospitals. Yes, I think it was a lot better back then than it is now, from the power to the services rendered. I think it's a lot better. It was a lot better back then than it is now.
Okay, now in the last 4 years now, we've had the Minister of Health, that's Professor Isaac Adewole, who has steered the affairs of the health sector and has held conversations. Yes, there are some successes, but we've also had some challenges. Now, in your own view now, would you say if the minister comes now again, gets the appointment, do you think it would be a fair platform?
I'm sure.
Given a second chance.
I'm sure he wouldn't want to come back.
Why is that?
I just feel that if I were in his shoes, I knew that it was Armstrong, or I believe it could have been Armstrong, it could be his pedigree to what he was able to achieve at the end of the day were not at par. So something went wrong somewhere. He's a good, a fantastic student in his days, a fantastic doctor. He got to the pinnacle of his career. He's politically active, being a CMD, being a vice chancellor of the university in Nigeria, and now the minister. I'm sure he will have done better if he had his way. I'm sure he will have done better.
Okay, now let's go back to primary health care. Now, where should we be as a nation today?
In primary health care center right now, I think the one experience I had was, I think, during my service here. Right now, it should get to the point where people can easily just come to the primary healthcare center. They don't have to wait so long because they have enough doctors. They don't have to wait so long because the queue is not so much. You have enough doctors, you have enough health workers, you have enough nurses, you have enough lab scientists that can take care of these people. But sadly, that's not the case. Even for patients that are usually admitted, sometimes it's so bad that they tell them to get some materials that ordinarily should be available in the hospital. You see people going outside to maybe buy plaster. Even if I've not experienced it, my colleagues, they complain about it a lot. They're buying plaster, they're buying bandages, they're paying for syringes. It's so sad. This basic, and it's not even that it's so expensive. Most of these things are very, very affordable. So we should get to that point where these people, these patients, they come to the hospital, they have enough doctors see them, they spend maybe maximum of 1 hour from entering the hospital to receiving their medications. But sometimes some people even come to the hospital and they don't even get to see the doctors. Why? Because you have this log of patients, lots of patients that are just, the doctor-patient ratio, it's so large. And we should have maybe one doctor to like thousands of patients. And daily, sometimes the doctor can see up to 200 patients. And when you have that kind of situation, they're always in a hurry because, first of all, if a patient is not seen, they get sad. So a doctor is trying to see 100, 200 patients. So they're spending less time than is required on each patient. So the medical error is now increased. So the doctor is in his part is trying to save more lives, but unfortunately the system is not giving him that opportunity to.
Okay. Now, Dr. Tunde, Obeleye made mention of the fact that we see our doctor-patient ratio not at a good balance, and we've also had quite an increase in medical errors as well. But now, talking about this ratio, we've seen a whole lot of brain drain of recent in the last 4 years, and now. And one of the most striking responses we've had from the Minister of Labour and Employment was the fact that if we have doctors in the country deciding to leave, well, it is all fair and it is all right because we have enough doctors to cater to the needs of the health needs of every single Nigerian in the country. Do you think that was a responsible statement from a minister of the Federal Republic of Nigeria and understanding the gravity of what that means, especially with the reality on ground?
Mind you, he's a medical doctor and he has defended himself. People even said that he was misquoted. He said he wasn't. I think he was taking into consideration freedom of choice. That why should people tie you down to where?
If we had systems that work, we would have all of those brains.
So indirectly, maybe what he was just trying to say is that, well, why would people move out? Maybe that's what he's trying to say. Or maybe it's just as some people said, maybe he was thinking of the traditional healers
Okay.
And
let me throw another one to you now. The Minister of Health as well, Professor Isaac Adewale, also made mention of the fact that the deplorable state of our teaching hospitals is just based on funds. Now, one would also ask that it's based on funds. The deplorable state is based on funds.
Yes.
Now, if we have a Minister of Health saying that, what's your take on such a matter? Is that responsible enough, or instead the conversation should rather have been on trying to push more for in terms of revenue allocation towards the health sector?
It should have been telling lies that the revenues that were there. It said
No,
the revenues were not there. If it wasn't given, he wouldn't be able to do anything about it.
So in all of the conversations, why couldn't it be pushed?
Really, there's always a lot of lobby. I mean, that's the way they put it. When the budget is being made and when the budget is being approved. And WHO has sometimes said 15%. At least 15%. And we have hardly done more than 5%.
That's sad.
You can't try that in some countries, and that government will go down immediately.
That brings you to my question, that then we have a minister who should push that agenda, but we're not seeing that being done.
Exactly.
It will have been pushing, but you won't get to know.
It's possible that it's actually pushing it, because one thing I always say is that despite the fact that the minister is there and all the blame is on the minister, it's not totally on him, because he can't just make that singular decision. So even if he's pushing, it passes through a process.
How do we then now develop that political will to place a premium on health?
Now,
that's a very good question.
Yes, the thing is, one thing that people should understand first of all is that health is not cheap. That's what people don't understand. Health is not cheap, especially when it has to do with health care. Taking care of yourself naturally is cheaper than the healthcare, but the healthcare system is not cheap. So the government, they have to understand that first of all. And even when these ministers, they are trying to push the bill and trying to say, okay, we need more money and all, at the end of the day, when it gets to the Senate, it has to be approved by these people. Do they actually look at it? Because just like I said, it's everybody. So we can do the best we can go on strike for all we want, but at the end of the day, the patients are going to suffer.
How do we build on this political will? Because now she touched on
political will.
The language here again, because we've also seen medical practitioners. The result has always been going on strike. We've had a whole lot of strikes in the last 4 years, and it's sad that there are so many innocent Nigerians whose lives have been toyed with because of these actions.
Since you don't have the statistics, and even if you have the statistics,
no, I'm not referring to deaths right now, but I'm saying that there are so many people in critical conditions.
Let me tell you one thing. The language all over the world now is universal health. And you were mentioning out-of-pocket expenses and all that, which is quite high in this country.
70% thereabouts.
Yes. So if the political will is not there, let me tell you, it's not rocket science. She said medicine is not. Let's take Lagos State as an example. Lagos State employed an actuarial service to determine what should be the premium for their contributory health scheme, and they came up with 70,000. That's
per annum?
Yes, for a father, a mother, and 4 kids. Well, Lagos State said, well, we only have 40,000. So let's roll this thing out. So because of that, then the business model the HMOs are using, you need to know. It's a game of numbers. So somebody said Lagos State has 22 million registered, blah, blah, blah. Well, to me, I think those people who really should be reckoning with in Lagos is probably about 2 to 3 million. And if you are thinking of 2 or 3 million people who are ready to take these insurance policies, where is the cross-subsidy going to come from? So the private hospital said they are not interested. So that leaves the government hospitals. The government hospitals, because they have no overhead anyway, should be able to do so.
Would you say we should also, you touch on
But how many are they?
health insurance scheme now? The coverage has been low, less than about 10%.
It's low.
Now, how do we
it's a game of
correct
numbers.
this narrative? How do we change this narrative this time around?
Let
Especially as we are redirecting the calls for the next 4 years.
Yes, it's not rocket science. For example, let me tell you. If Lagos State, for example, says, okay, we already have a demography of vulnerables, that is people who cannot, they've always said that. And then they said, okay, we have suggested so many ways, sin tax, this tax, this tax, this tax. I don't know why they are not doing so. Maybe they don't want money to just come into, because by fiat, if you say, okay, for every bottle of beer that is bought in this country, 1 naira should go into the health fund. For every recharge card that is bought, maybe 10 kobo should go into, all those kind of things that's happening in some other countries and it's working. I don't know why we can't do that. And then have this large fund. If you have this large pool of funds, then we won't be talking about it.
What is your expectation for the next Minister of Health now? The President has not yet revealed any information towards its cabinet, but what do you expect now from the next Minister of Health in terms of driving conversations for the next 4 years?
I think he will just have to double the work of the past minister, and if he can actually triple it, because just like we've always said, the condition of primary health care centers, the condition of government hospitals, it is very deplorable. So it just has to put a lot into consideration. If not, the same thing that's been happening over the past 8 years is the same thing that will still happen. Doctors will get tired, they will go on strike because of the basic amenities that they actually need and it's not available. And it's just basic things. It's not, it always says it's not rocket science, and really it's not. They're actually just very basic things. If they can actually look at it. I think sometimes the challenge is because a lot of people just want to put money in their pocket. It's sad, but that's the reality. And these are the people that at the end of the day, when they have medical issues, they fly their children abroad, they fly themselves abroad. But the people that are actually here, the grassroots, they don't even have money to just even sometimes afford the basic drugs. So I think sometimes these people should actually forget their selfish reasons for going into power and actually push the agenda of the masses and say, okay, this thing is what we really want to do, and let's just try and just make it, let's try and move forward from where we are now, because most people, all they just want to do is just put money in their pocket.
How do we address the menace of medical tourism today in Nigeria?
Very easy. Nearly everything that you can get elsewhere in the world is right there in Lagos. I can assure you of that. But can the ordinary person afford it? No. That's why I keep talking of funding. If you decide that, okay, all vulnerables, we have them in Lagos, they're about 120,000, and this is a fund for them. Whether they are ill or not, this is what you get. That's what we call capitation and all that. Okay. And they take the risk. It's just the same thing for emergencies. Somebody just got hit by a vehicle, they take that person to the next hospital. That next hospital now treats. Who pays? There should be a fund for that. And all these things are not hard. But they keep saying that health is in legislative, one is in concurrent and all that. When they do that, that means the states can decide that this is what we want to do. That's why I'm just saying Lagos State, for example. Lagos State has LASEMA or something like that. Not most states have that. It's very effective because government puts money there.
We earlier talked about on the National Health Insurance Scheme. Would you say we should scrap it off and then start afresh, or what reforms do you expect to see this time around?
We don't need to scrap it off. All what you need to do now is there's a board, there's a council that's administering the NHIS as it is. Maybe you've not been following the story. The story is that about 2 years ago, somebody was brought in to be the chair, to be the executive secretary of that regulatory body, and everything has been in disarray. Disagree with HMOs, disagree with providers, disagree with, it was like a lot of manner. At the end of the day, he was asked to step aside. After about 100 days, he was brought back there. And after about another 6 months, it was suspended again. Till now, somebody was supposed to hold the can there for 2 weeks for the anomalies to be sorted out. This is the 27th week. Then the reports of those investigating panels were leaked. That this guy was indicted, but they said, no, he should not be prosecuted. I don't know why. And you see, you say, what is my take there? I'm the current chairperson of the HMOs, all registered HMOs that are accredited. Not necessarily all HMOs, some HMOs are not registered under HOS, and they are free to do whatever thing they like.
It's so sad.
And it's so sad.
It's so sad.
But if you've made it as part of your regulation that once you have an HMO, you are accredited by NHIS, you belong to this association.
Okay. Salaries of medical doctors as well has also been another touchy subject as well, which has led to so many strikes. How do we also deal with this situation where remuneration goes right?
The thing is, in the first place, the money is not even, they don't even have enough money to even fund the hospital. So how are they talking about to even raise the money for the doctors and the nurses and every health worker? Because first of all, okay, let's talk about priorities right now. Priority is making sure basic amenities are available. I will keep insisting on that, are available in the hospital, but they're not even available. And when these doctors are talking and crying about money, they're not even talking, most of them are not even talking about a raise. They're talking about the one that has been promised already, the existing one. Why not even pay us? There are some people that work in government hospitals, and sometimes for months, I personally experienced it, for months they don't pay them.
But our governors have their monies paid right on time.
Exactly. So it's bad enough that they don't even have enough money to fund the hospital. Then the doctors and the nurses and every other health worker working there, they don't even pay them. They owe them for 2, 3, 4, 5, 6, 7 months, some of them even over a year. Personally, I wasn't paid for 8 months while I was working for a government. So it's actually sad. It's sad, seriously.
One of the future dreams of Nigeria is to see local production of vaccines. Do you think in the next 4 years?
We were producing vaccines before.
But we are no longer producing.
We are no longer producing.
How do you think we can redirect our step to that area where
area of research. Even as we operate now, one of the questions you asked at the beginning was that what next? What are the? Well, a lot of us don't keep datas. When you have datas, it helps. It helps you plan. And then we don't. Then researches. We are not doing that anymore. I remember when I was still a medical student, we were producing vaccines in Yaba.
Who is now to blame?
And they were well, if you say who should blame, I don't know. If you are no longer interested in those things, you are no longer interested, and you're the one in control of everything. Once you have, you see, the funny thing is that even if you make a medical doctor the president of this country now, he may just come and tell you that that's not his priority to do research. Yes. There are people who are putting money into research. There are some of us who will have loved to be in research. If it's possible for me to hand what I'm handing now, and you just put me somewhere and say, okay, continue doing research, that's where I'll be. But I'd rather not be there now and start.
Okay, so now...
There's not much money in the business.
No.
Okay, so now in the area of essential medicine too, how are we supposed to be addressing these as well, especially at primary healthcare level? Why that?
You keep asking very, very fundamental questions. I said
it's simple, but we are not doing anything.
Will. If there's political will for this country to continue to produce its paracetamol, its ampiclos, simple things like that.
Exactly, simple, basic things.
You make sure that
we have issues with distribution. We have issues with even collecting the expired ones.
Positive.
It is a whole lot of chain of irresponsibilities here and there that shouldn't be excused. So
true, and that's why we should really have good regulatory bodies, because when we have good regulatory bodies, right now we have a lot of people producing very fake, bad drugs. If we have good regulatory bodies, in the first place, they will ensure that, okay,
NAFDAC.
Exactly. And if they're really functional, You make sure that, okay, these people producing wrong fake drugs, at least they are cut off. Because you have a lot of people, now it's so bad that now the doctors, they've done their part, the nurses, they've done their part. All they have to do is take the right drugs. And they go to the pharmacy and they're even getting the wrong drugs. So we've done everything we can without pay. And at the end of the day, the masses still suffer because the governments, they're not having good regulatory mechanisms in place that will actually make all these things possible.
Do you think as one of the possible eases that we would have within the healthcare system is to have subsidies of drugs? Now, for example, you look at, there's this case in the United States where they are trying to push for subsidies for Truvada to reduce the cost. That's right. That's for antiretroviral drugs. And in Nigeria, we are not necessarily thinking in the line of subsidies.
It costs about $2,000 for a month's dose in America. And it's about $200.
And it was public funds that was used to do the research.
So, because of that, to get to that, in Nigeria too, to get to that, when people will now be thinking of the long-term gain rather than the immediate gain.
The truth is, a lot of people don't really take health as priority.
It's not.
That's actually a very sad truth, but it's the reality. Okay. You see people coming from the clubs, you see people that have spent millions of naira, they come and they're telling them to pay a registration fee of 3,000, 5,000, and they say they don't have money. And these same people leave this place and they go back to the club and spend millions of naira. Actually, that is really sad.
Okay, let's talk about killer diseases now, especially for children under 5, because we just celebrated the Children's Day. We look at the likes of meningitis, you look at malaria, HIV, measles, pneumonia and polio. And as it's the year 2000, we had deaths of about 4.6 million. 2015, we slashed that to about half, and we've just remained at that plateau. We've not necessarily done better since. How do you think we can also improve in managing all of these health situations?
You see, culturally, there are some parts who do not really believe even in...
I'm talking about state levels now, states taking the reins by...
Even the states, if you look at the statistics, they are quite different. Some are doing very well, some are not doing well. And again, you have to view some of the reports you are getting with some suspicion, because we don't really have the data, especially current data. So we keep relying on data that are past. You can imagine going to a conference abroad, and then you are making reference to
2015, 2002,
2007.
So we're not doing enough in that regard. But as we said, if there's a political will to make sure things work, it will work.
Let's talk about the political will then much more. Now, we have new governors who are coming into play. Good. We have old ones who have had 4 years experience and are supposed to consolidate on all of the different plans and blueprints. What do you expect this time around? Reel out 5 different strategies or steps to be taken.
Those states that do not already have the legislation in place on universal health care or contributory schemes, they should do so. Get it to their houses, so that whether somebody comes after you, once you have started, you have started. 2, I didn't think of, when I was talking of syntax and the rest of it, you can be unique in your own way. Then, and I've said, the ombudsman in the business is HMO. Some of the states believe that the HMO should be out of it. They want to continue paying the... Okay, let them try it. They will know what it means. A few people have, the regulator man I was talking about came in and said, I can pay hospitals for my laptop, so I don't know what these HMOs people are doing there. So that's the third. Then the fourth one, as I said, is let's keep talking about the advocacy has to increase, the awareness has to increase. Let's just, everything now is about health. Everything, you go to this corner, everybody's talking about it. This forum now, we're talking about health. Next, you go to another forum about health. Let's put money into it. Let's walk and talk.
Obele, now in your last words now, the president has not necessarily, in all of the different speeches that he's had presented so far to Nigerians, he's not necessarily touched on health. He hasn't given any speech today, but when he's going to give his speech, would you expect he's going to touch on it, and what would you like to hear him mention? Because he's talked about the police and judiciary, but silent on health and other sectors as well.
Okay, we're hoping, in Nigeria, we'll never stop being hopeful. So we're actually hoping that he will actually talk about health. We are hoping that the allocation, the annual allocation to health is going to increase, and we're hoping that
they've already signed.
It's been signed.
And it's still
so maybe 2020.
Oh my goodness.
What we would like to see is possibly the implementation of the funds now being made available for the health sector. It goes down properly, and we don't give any excuses here and there.
The truth is, he just can't do everything. It's just like a father that gives the wife money to go ahead and cook, and she hoards like 70% of the money, and she uses 30%, and she cooks, and she gives the elder sister to go and share the food, and the elder sister takes like 70% out of that before she gives it to the younger ones. I think all of us were responsible for this to make this actually work. So it's from the president down to the minister, down to the
commissioners.
Down to the commissioners. It's everybody. We just have to put our selfish desires aside and just think about the masses, because at the end of the day, it could be anyone. It could be anyone down there. It could be anyone as the patient.
And truth be told, it's supposed to be the language of the masses, because it's the masses that actually puts all of these state and federal actors in power, isn't it?
Positive.
Well, according to the books
true.
and the books. Thank you very much for your time, Dr. Tunde Ladele. It's been a pleasure speaking with you. And we've also had Dr. Obeleye Arinye Dokiari. Thank you very much.
Thank you.
And we've just discussed matters relating to the health sector. Please keep your comments coming in, and we'll take them right after this quick break. And I'll be joined by my co-anchor, Mariano Cohen.